This conference will now be recorded.
Hello, my name is Amanda Kulik, and I work with the SHINE program. There are 11 PSAs, and I work in PSA 9. That's Palm Beach and the Treasure Coast. Today, I have the opportunity to present to you our Medicare Advantage Plan presentation. Note that if you're brand new to Medicare, our Medicare Basics or Medicare 101 presentation may be more suited to you before watching this video. Let's dive in. So the SHINE program is a Florida Department of Elder Affairs program. The SHINE program is part of the nationwide State Health Insurance Assistance Program, also known as SHIP. There are SHIP programs in all 50 states and all U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a federal SHIP grant. The Florida Department of Elder Affairs' vision is for all Floridians to live well and age well. SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed health care choices. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Centers. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. The Department of Elder Affairs administers programs and services for elders through contracted agreements with 11 Aging and Disability Resource Centers in Florida. The centers are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with Aging and Disability Resource Centers to provide counseling services locally. The primary duty of volunteer SHINE counselors in Florida is to help seniors identify, understand, compare, and/or enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplemental insurance, also known as Medigap. They're also there to help screen for and apply for programs that assist individuals with paying for Medicare, such as the Low-Income Subsidy, also known as Extra Help for Prescription Drugs, and the Medicare Savings Program. SHINE counselors also provide counseling for long-term care planning and assist with Medicare complaints and appeals. Through the SMP grant, SHINE counselors can provide education on Medicare fraud and abuse, including how to prevent yourself from fraud, how to detect fraud, and how to report fraud. Let's talk about Medicare Advantage plans. In order to understand Medicare Advantage plans, it is important to understand how it fits into the world of Medicare. Please note that if you'd like a copy of the Medicare Basics chart, it's available on our website, floridashine.org. Click on the Resources tab. There are two paths to Medicare coverage: Original Medicare or Medicare Advantage. We emphasize the "or" because you can get your Medicare coverage from one path or the other. You cannot have a Medigap and a Medicare Advantage plan at the same time, as they are on two different paths. The first path is Original Medicare, which began in 1965. Medicare Part A is hospitalization coverage. Some pay premiums for this coverage, those with less than 10 years of FICA credits. All pay the Part A benefit period deductible and any copays associated with inpatient care. Part B coverage is your medical coverage. All pay the monthly premium, the annual deductible, and the coinsurance. There are some optional coverages to Medicare Part A and B. Medigap's are a Medicare supplement. These are provided through private insurance companies. They bridge the cost of Original Medicare. Costs include monthly premiums, and some plans include an annual deductible. Part D is for drugs, prescription drug coverage. These are also offered through private insurance companies. Costs include monthly premiums, annual deductibles, and coinsurance. Costs vary within each plan. Now we will switch and talk about the other path, also known as Medicare Advantage Plan. Please note that if you'd like more information on Original Medicare, we suggest again that you take a look at our Medicare Basics or our Medicare 101 presentations. We dive in deep into the topic of Original Medicare during those presentations. The alternative path for Medicare coverage is the Medicare Advantage Plan, started in 1997. Part of the Medicare program, it is also known as Medicare Part C, an MA plan, an MAPD plan, or Medicare Health Plan. Advantage plans are approved by Medicare and offered throughout the country by private companies that sign a contract with Medicare. Each month, Medicare pays a set amount of money to these health plans for their members' health care. This is called a capitation rate. With Medicare Advantage plans, you receive all Medicare Part A and B Medicare covered services through the plan. In some plans, you may only be able to see certain doctors or go to certain hospitals. The cost structure of Medicare Advantage is different than Original Medicare. Therefore, the beneficiary's cost sharing will be different. Most plans also include Medicare prescription drug coverage. Some plans provide additional benefits such as vision, dental, and hearing. If you join a Medicare Advantage plan, you must continue to pay the monthly Medicare Part B premium. Everyone is charged a monthly Part B premium. There may be some costs you may pay to the plan, such as an additional monthly premium. You may be asked to pay deductibles, coinsurances, and copayments. Note that out-of-pocket costs are different from Original Medicare, that they vary from plan to plan, and that costs might be higher if you go out of network. In this section, we will discuss eligibility enrollment questions. We will be covering questions like, when can you join or switch plans, and who can join? Medicare Advantage plans are available to most people with Medicare. To be eligible to join a Medicare Advantage plan, a person must be enrolled in Medicare A and B, live in the plan's geographic service or continuation area, People with end-stage renal disease, also known as ESRD, usually cannot join a Medicare Advantage plan or other Medicare plan. However, there are some exceptions. If ESRD is developed while enrolled in a Medicare Advantage plan, a person may continue to be enrolled in that plan, and some Medicare Advantage special needs plans accept people with end-stage renal disease. Another situation is a person who receives a kidney transplant and who no longer requires a regular course of dialysis. This individual is not considered to have ESRD for the purposes of Medicare Advantage eligibility. To join a Medicare Advantage plan, a person must actually enroll, as enrollment in Advantage plans is not automatic. The beneficiary must also agree to provide the necessary information to the plan, agree to follow the plan's rules, and belong to only one Medicare Advantage plan at a time. Since Medicare Advantage plans are a part of Medicare, one may only enroll during an official Medicare enrollment period. Let's talk about some of those enrollment periods. Initial enrollment period is when most people first become eligible for Medicare. This is a 7-month period which begins 3 months prior to your 65th birthday. You can elect either Original or Medicare Advantage. Open enrollment period happens every year. Medicare provides the opportunity to change your Medicare coverage. It is only for those who are already enrolled in Medicare. It runs from October 15th to December 7th, with coverage starting the following January 1st. One can switch between Original and Advantage, change from one Advantage plan to another, or just change drug coverage. These are the most common special enrollment periods. Working aged is a special enrollment period for those who declined Medicare Part B when they were first eligible because they were covered by their or their spouse's employee group coverage. When the employment or the coverage ends, whichever is first, this special enrollment period begins. When you change your permanent address, you need to check with your plan to see if you have also moved out of your planned service area. If so, Medicare allows a special enrollment period for this transition. You also have a special enrollment period if you move within your current plan service area, but more plan options are available at the new location. If your plan leaves Medicare, a company may choose to no longer participate or may have its contract terminated by Medicare. An involuntary loss of creditable coverage. If you lost coverage that was as good as Medicare, also known as creditable coverage, or the plan changes and is no longer considered creditable coverage, you may qualify for a special enrollment period. Upgrading to a 5-star plan. If you are in a plan rated below 5 stars and a 5-star plan is available in your area, you may upgrade from your current plan to the 5-star plan during the year. General enrollment period is for those who did not who did not enroll in Medicare when they first became eligible and do not qualify for a special enrollment period. You may enroll in Part A and Part B from January 1st to March 31st. Then you may switch paths by enrolling in Advantage or staying on the original Medicare path and adding a Part D plan. Medicare Advantage open enrollment period is for a person who is in a Medicare Advantage plan and wants to return to original Medicare. They may disenroll during this period of time. The period is from January 1st from March 31st. If you go back to original Medicare during this time, plan coverage may take effect on the first day of the month following the date on which the election or change was made. You may also disenroll from a Medicare Advantage plan and return to original Medicare, or you may switch to a different Advantage plan. You may switch to a different Advantage plan during this period. You can make a request directly to the Medicare Advantage organization you wish to select, or you may call 1-800-MEDICARE. If you make this change, you may also join a prescription drug plan to add drug coverage. This is only if you have switched to original Medicare. Coverage begins the first of the month after the plan gets the enrollment form. When Medicare beneficiaries choose the Medicare Advantage path for the first time, they are eligible for a trial right. The trial right allows the beneficiary to enroll from a Medicare Advantage plan during the first 12 months of coverage, disenroll from this plan, return to original Medicare, pick up a standalone prescription drug plan, and have the guaranteed issue right to purchase a Medigap supplemental policy if they had one prior to the Medicare Advantage plan. Medicare Advantage plans may vary. We will review the different types of plans offered. Remember to read individual plan materials carefully to make sure you understand that plan's rules. You may want to contact the plan directly to find out if the service you need is covered and how much it costs. Let's start. We'll start with health maintenance organizations, also known as HMOs. There are general rules for how Medicare HMOs work. In Medicare HMOs, the copayment or coinsurance amounts a member pays for services received are set by the plan. There are doctors and hospitals that contract with the plan, called the plan's network. People generally must get their care and services from the plan's network. Call or get a list from the plan to see which doctors and hospitals are in the plan's network. Even if you see your doctor on the list, it's a good idea to contact your doctor to verify before enrolling in the plan. People who get health care outside of the plan's network may be required to pay for those services themselves. In most cases, neither the Medicare HMO nor the original Medicare plan will pay for these services. The service area is where the plan accepts members and where the plan services are provided. Members are covered if they need emergency or urgently needed care and aren't in their plan service area. People who join a Medicare HMO plan may be asked to choose a primary care doctor. They usually need a referral to see a specialist, such as a cardiologist. People who are considering joining an HMO and want to keep seeing their current doctor should call and ask if he or she is in the HMO's network and can continue to see them if they join the plan. Depending on their contract, doctors can join or leave an HMO's network at any time. When a primary care doctor leaves an HMO, the plan will notify his or her patients, usually within 30 days in advance, and provide an opportunity to pick a new doctor. Most Medicare HMO plans cover prescription drugs. If you want an HMO and prescription drug coverage, you must join a plan that offers prescription drug coverage. If you join an HMO plan that does not offer prescription drug coverage, you cannot join a standalone Medicare prescription drug plan. HMO point-of-service plans provide some coverage outside of the HMO's network. Many like to think of HMO POS plans as a combination of HMO and PPO plans. Preferred Provider Organizations, or PPOs, can see any doctor or provider who accepts Medicare. They do not need a referral to see a specialist or an out-of-network provider. Every Medicare PPO plan must cover all services received out-of-network, but every plan is different in what their members must pay. The out-of-network charge may be up to 100%. Most Medicare PPO plans cover prescription drugs. If you want a PPO and drug coverage, you must join a PPO plan that offers prescription drug coverage. If you join a PPO plan that does not offer prescription drug coverage, you cannot join a standalone prescription drug plan. A Medicare private fee-for-service plan is a type of advantage plan offered by private insurance companies. Each plan determines how much it will cost doctors, other healthcare providers, and hospitals, and how much you must pay when you get care. Some PFFS plans contract with a network of providers. Out-of-network doctors, hospitals, and other providers can decide not to treat you if you've seen them before. For each service you get, make sure your doctors, hospitals, and other providers agree to treat you under the plan and accept the plan's payment terms. In an emergency, doctors, hospitals, and other providers must treat you. You only need to pay the co-payment or co-insurance allowed by the plan for the type of service you get at the time of the service. Beneficiaries can get Medicare prescription drug coverage from the private fee-for-service plan if offered. If it is not offered, this is the one type of Medicare Advantage plan that can also allow you to join a standalone Medicare prescription drug plan. Special needs plans are designed to provide focused care management, special expertise of the plan's providers, and benefits tailored to enrollee conditions. For example, a special needs plan for people with diabetes might have additional providers with experience caring for conditions related to diabetes, have focused special education or counseling, and/or nutrition and exercise programs designed to help control the condition. A special needs plan for people with both Medicare and Medicaid might help members access community resources and can coordinate many of their Medicare and Medicaid services. All Medicare special needs plans must include Medicare prescription drug coverage. There are 3 categories of Medicare special needs plans. For people with certain chronic and disabling conditions, for those eligible with both Medicare and Medicaid, and for people in certain institutions, such as a nursing home. Medicare special needs plans are only available in certain areas. Approximately 19 million Medicare beneficiaries are enrolled in Medicare Advantage plans in 2017. The majority of enrollees are in Medicare HMOs, which have been an option under Medicare since the 1970s. Fewer beneficiaries are enrolled in other types of plans. The terminology group plans is referring to plans sponsored by unions and employer for retirees. Medicare Advantage considerations. There are certain considerations regarding current and future coverage that you should look into before choosing a Medicare Advantage plan. For example, are my prescription drugs covered? Will I need to select a primary care doctor? Can I receive my health care services from any Medicare doctor or hospital? Will I have to see a primary care doctor first to get a referral to see a specialist? Rights and protections. All people with Medicare have certain guaranteed rights and protections. You have these rights and protections whether you are in Original Medicare, in an Advantage plan or other Medicare plan, have a Medicare drug plan, or have a Medigap policy, also known as supplemental insurance. How Medicare Advantage plans work. It's important to note that people who join a Medicare Advantage plan or other Medicare plan still have Medicare rights and protections. And if the plan decides to stop participating in Medicare, you may join another Medicare health plan or return to Original Medicare. The following rights are guaranteed. You have the right to get health care services you need. You have the right to receive easy-to-understand information about your coverage. You have the right to have your personal medical information kept private. You have the right to choose health care providers in the plan so you can get covered health care. You have the right to get a treatment plan from your doctor if you have a complex or serious medical condition. A treatment plan lets you see a specialist within the plan as many times as you and your doctor think are necessary. You may ask your plan to learn how your doctors are paid. Medicare will not allow a plan to pay doctors in a way that interferes with you getting needed care. You have the right to ask your plan to provide or pay for a service you think should be covered, provided, or continued. This includes a fair, efficient, and timely appeals process to resolve payment and coverage disputes with your plan. You may also file a grievance about other concerns or problems with your plan. For example, if you believe your plan's hours of operation should be different, or there are not enough specialists in your plan to meet your needs. Check your plan's membership materials or call your plan to find out how to file a grievance. Get a coverage decision or coverage information from your plan before getting services to find out if it will be covered or to get information about your plan's coverage rules. For more information about your rights to privacy, look in your plan materials or call your plan. Marketing guidelines. All Medicare plans, whether they are Medicare Advantage plans or prescription drug plans, must adhere to strict marketing guidelines. Failure to do so could result in a fine or other actions. All marketing materials, such as brochures, flyers, and other items, are pre-approved by Medicare. Details regarding plan coverage and services provided are given at the time of enrollment and annually by means of an annual notice of change or an evidence of coverage notice. Plan sales agents may not knock on your door, cold call you before or after a sales event, and they may not email you or approach you in common areas such as hallways, lobbies, sidewalks, or parking lots. During marketing of Medicare Advantage plans, organizations may not include annuities, life insurance, or other products. Organizations may be able to do the following. There are occasions when an organization may contact individuals, such as when you gave a plan or sales agent permission to contact you. When they want to offer a gift to potential enrollees at events, as long as such gifts are of nominal value, less than $15, and are provided whether or not the individual enrolls in the plan. They may contact their members who are eligible for extra help and may assist with application for cost-saving benefits. These type of calls are pre-approved by Medicare. Organizations may call existing members to conduct business related to enrollment in the plan. They may also call former members after they have disenrolled from the plan to conduct a survey for quality improvement purposes. The Internet is full of information about Medicare, and not all of it is accurate. Medicare.gov is the official website for Medicare and has the most up-to-date information. The information contained on this site is deemed accurate and reliable. Like most websites, the layout and appearance of this site may change in the future as it is updated by CMS. The Medicare.gov Plan Finder is a great way to see what Medicare plans are available in your area and help you decide which is best for you. Let's talk about financial assistance programs. The Medicare Savings Programs are part of the National Medicare Program and are designed to help beneficiaries with an income that does not exceed 135% of the federal poverty level. Asset limits also apply. The federal poverty level can change every year. The QMB, SLMB, QI1, and QDWI programs are collectively known as the Medicare Savings Program. Extra help with prescription drug costs, also known as the low-income subsidy. Depending on a person's gross monthly income and assets, they may be eligible for reduced Part D insurance premiums and deductibles, and will only have to pay a minimal amount for their prescriptions. Certain people qualify automatically for extra help and do not need to apply. People with Medicare and full Medicaid benefits, including prescription drug coverage, are referred to as dual eligible. People with Medicare who get supplemental Social Security income, also known as SSI benefits, but do not have Medicaid, do not need to apply. People who are enrolled in the Medicare Savings Program already. People who meet their medically needy share of cost Medicaid dollar amount at least once during the calendar year. People who qualify still need to join a Medicare drug plan to get extra help paying their prescription drug costs. If they don't join a plan on their own, Medicare will enroll them in a plan to make sure they have coverage. Medicare will send them a notice telling them what plan they are in and when their coverage begins. They may switch to a different plan of their choosing once per quarter. Other people with Medicare should file an application with the Social Security Administration to find out if they qualify for extra help. They can apply with the Social Security Administration online at www.ssa.gov, or you can reach out to your local SHINE programs who can screen you and help you apply. Medicare fraud and abuse. The following slides present an introduction to Medicare fraud and abuse. Medicare fraud is purposefully billing for services that were never given or to bill for a service that has a higher reimbursement rate than the service provided. Medicare abuse is payment for items or services that are billed by mistake by providers, but should not be paid for by Medicare. The difference between the two is intent. Now, let's learn the three most important steps that will prevent you from becoming a victim of Medicare fraud and abuse. Prevention. Here are some tips to protect yourself from healthcare fraud. Treat your Medicare card like you would a credit card. Only share Medicare cards and numbers with trusted sources who need that information to serve you directly, i.e., doctors and pharmacies. Do not rely on advice or offers from unknown persons who call, visit, or approach you in public. Never sign a blank medical or insurance form. Detection. Medicare sends you 2 notices for your claim information. The 2 notices are the following: the Medicare Summary Notice, also known as an MSN, or an Explanation of Benefits, EOB. These notices allow you to review your Medicare claims and check for possible mistakes. Report. If you see something unusual on your Medicare Summary Notice, check with your plan or call SHINE. If you get a call from someone requesting your Medicare number, do not give it out. Call the Federal Trade Commission and your local law enforcement. You can reach the Federal Trade Commission at 1-877-382-4357. If you believe you are a victim of fraud or abuse, contact your local law enforcement and SHINE for more information. If you have any questions or comments, please reach out to our helpline at the Area Agency on Aging of Palm Beach and the Treasure Coast. You can call us at 866-684-5885. You can also reach out to the State SHINE program. Thank you and have a great day.